This conference will now be recorded.
Councillor DeMott, thanks so much for joining us, and thanks for what you do on council and especially your interest in mental health in our community. And I know that's a passion for yours, and we're going to spend a few minutes kind of talking about what's unfolding in our community. And I guess I want to get your perspective of what the impact from the COVID-19 pandemic has meant on a lot of people's mental health. Clearly, people are struggling financially. Many have lost their jobs in some cases. Talk about some of the statistics you're hearing about both in Adams and Jefferson counties.
Yeah, so we were provided some points, and so just to share some information with folks. So between both health departments, for example, they're seeing that about 53% of adults report that their mental health has been impacted over COVID. And I think you see varying degrees of why that might be, and some of the statistics show like difficulty sleeping or eating. And really the rise in substance abuse. And I think we've heard all of our leaders from the president on down to our governor really talk about these issues because of, mental health before COVID. It was a big concern. And, this just really exasperates it. And a lot of that could be things between job loss or just stress of the unknown, stress about the virus itself and how it might affect your loved ones, or maybe you've been impacted yourself or your loved ones have. So it's definitely been wearing on people. And, so I think that the city leaders and up the chain, we've all been really trying to be mindful of that. And I would actually give a lot of kudos to a lot of the businesses out there. I've seen a lot of the business community really, I think in general as a society, have stepped up around mental health. But I definitely have seen extra care in my own employer and other employers and the ones we deal with through the chamber, and even what the chamber has done to make sure that we're addressing this, because it like we've talked about in city council meetings, it touches all facets of life. We have different roles that we play and how we help that situation, but it definitely it touches everybody at some point in their life.
And a lot of times it is awareness and being able to talk and be able to find resources to help. And I guess that would be the next question. What can our residents do if they or someone they know may be struggling with a mental health challenge?
So I think, one thing is not to shut yourself off from other people. It's easy to do. There's such a stigma around mental health. And I think that's why my wife and I are so passionate about it, and why I really push in my position as a council person and really in all facets of life. We have a daughter who is schizoaffective, and we went through a lot of time trying to figure out exactly what was going on with her. And putting your finger on a diagnosis, I think no matter if it's a mental health or physical health or really anything, helps you figure out what your next steps are. So using those resources that are available. So like, for example, Community Reach, which you can reach at 303-853-3500. Or the Colorado Crisis Services, which, if you're feeling you're in a place where, you're just down, talk to somebody. And so that number is 844-493-TALK, which is 8255. There's also a text service. I'm not sure off the top of my head what that is, but, having those resources available for you or to share with other people, and I would say on the other end, if you're not necessarily somebody who is experiencing it yourself, we all know somebody, and like making sure that people aren't isolating. I think things are a little looser than they were a couple months ago as far as people are out, but there are certainly people who aren't comfortable because of maybe they're in a risk demographic. Make sure that you're checking on those folks. If you have loved ones or friends or neighbors even, and you haven't seen them for a while, that's something we as society could proactively do to make sure that we're taking care of each other.
Yeah, some really good advice there. Our police officers, as you know, are on the front lines for mental health support as they get called to deal with situations all the time. Many times, unfortunately, they're dealing with somebody who may be in a mental health crisis. Talk a bit about what that looks like in Westminster, and especially some of the unique programs that our own department is unfolding.
So one of the things that all our officers go through is crisis intervention. And so that we have a specialized team that's basically called the SIT team, which is Crisis Intervention Team. And so, our officers have went through training. So like if you ever have time as a resident or an employee, I know a lot of our employees will go through our academies, but we have a citizen academy for both our police and fire departments And I've been through those, and they kind of do some ongoing training. So I've seen some of the training that our officers do firsthand, got to go through like a crash course of it. And really that helps them know when they're dealing with an individual, is this individual in crisis? Is this individual maybe in a situation where they're have a substance in them? So maybe a substance abuse, which oftentimes those two things cross often with mental health. It definitely leads to some substance problems in people. But we do a lot as a city to stay ahead of the curve. And I think it's really important for residents to understand that about their police department and their city, because a lot of the things that we've been hearing about that people want to see in police reform, the city of Westminster is ahead of the curve in my opinion. We do a lot of the intervention and training and stuff, and I think that's good, both for the safety of our citizens and our officers.
And you bring up a good point. One of the ways that our department, with council's support, is staying ahead of all this is through our Coresponder program. And that is a really interesting way to deal with these challenges and support not only the officers, but those who are in crisis.
Yeah, and so it's interesting, the Coresponder program, I am a big advocate. There's a lot of cities who are doing that, and it's basically a clinician that will go with the officers when they're requested. If they, and again, this isn't only the clinician dealing with mental health situations. And I think that's important people realize that as we talk about how we want to see our police departments interact with the public and in funding sources, because all these different needs that we have as a society aren't necessarily replaced by adding something like a clinician. They're working in conjunction as a team with our officers. And there's a lot of cities that are doing this. And so we're partnering with Community Reach Center is our partner. I know Arvada has a similar program too, but the goal is basically to have these clinicians go with them and be able to diagnose, should this person maybe be checked for a mental health check or taken to a facility that's going to deal with that opposed to jail. I think one of the things that people really need to realize in Colorado and the nation at large, that's one of the bigger problems, is once they diagnose is where to take somebody. So being able to figure out is maybe the clinician can get them some resources so they don't have to go to a facility, or maybe they can help diagnose what the issue is. But it really is in partnership with the police department. If you think about sometimes those situations, the person, maybe there's a weapon involved, so we want the police there to keep the clinician safe. So when you think about a lot of these different funding things, you need to holistically think about the problems they deal with. I know that this came about because we were able to get a grant through the state, so I'm very grateful that the state does those grant programs. And I think that these are great programs, and I'm very thankful that our police department was forward thinking. This particular thing partially came about, we were having a strategic plan as a council a couple of years ago, and I brought up a situation where my own daughter at the junior high ended up in the back of one of our police cars, and this was early on in me being a councilman. And I really think that was his options at that point. And so we had to follow protocol both for his safety and whoever they're dealing with safety. But I think to me it was a glaring example of somewhere where we as a society could do better, and that's about giving that officer some different options so that he doesn't have to take it to that route. So it's a great program, and I really am very thankful, as well as I think the community should realize that we have that.
We are too. It is saving financial resources, but as you mentioned, it's also saving lives, and I know our officers really love it too. We just have a few minutes left. And any call to action that you would state to our residents right now who are watching? What is it that they can do to maybe lean in and help support each other?
I kind of alluded to it earlier. It's about looking out for your friends and neighbors, or even people you don't know. It's a stressful time in our nation. There's a lot of different things going on between COVID and an election, and just the different racial tensions that we've seen through some of the situations that we've had unfold in the nation. And I think it's a good point for self-reflection as a country, and realize we do have some things that we need to get through, but it's better together. And just like I was saying, with the mental health stuff, you can help other people by paying attention and having a listening ear. I think a lot of our problems today could be solved by being able to just talk to each other, look out for each other, you know, realize at the end of the day, we all got to get through our days. And so I really think we can do that better together, you know, in society. So that'd be my parting thing. And, you know, use some of these resources if you need them, or have them at hand for other people. You know, I remember when we first realized our daughter had some mental health things, we didn't know what to do. We never really thought we would be dealing with that. So trying to understand at some point in life, we all might have varying degrees of a situation, and having those resources on hand, I think proactively will help you if you ever run into that situation with yourself or a loved one.
Some very good advice. As always, Councillor DeMott, thank you so much for
Yep.
joining us, and thanks for what you do on council. We appreciate it.
Yep. Thank you, Greg.